So first I would start off by coming in and introducing myself and letting them know that we're here to help and make things a little bit easier for them however we can. First, we would start off simple and maybe talk about some simple hand hygiene that can prevent a lot of illnesses in children, especially. Make sure that they're getting bathed every day and washing their hands before and after eating, before playing outside or after playing outside. Keeping their clothes clean and change them when they get dirty so that they don't go to bed and have all that bacteria on them, or try to eat and have all of, the dirt and stuff on them. We would try to give them some healthy eating options. We know that it's really hard sometimes with kids in general, that we get in a hurry and we get busy with our life issues and work and trying to raise kids. It gets tough, and so sometimes it's just easier to run through a drive-through or give them a bag of chips or some fruit snacks or whatever to make it easier for everybody. But we would offer, maybe some fruits and vegetables, milk and eggs, some whole grain foods that they could get. Try to limit the candy and chips and soda as much as possible. Maybe replace the soda with some water or 100% juice. Which that also goes along with dental caries, dental hygiene. We want to make sure that they know that they brush their teeth 2 times a day, every day. Use small toothbrushes, soft bristle with a little bit of toothpaste, and try to go to the dentist every 6 months if you can. We know that it's also hard to do when you have lack of insurance or you have lack of time, but we want to make that as easy as possible for them to get their teeth cleaned every 6 months as they can. We want to talk about maybe some good sleep hygiene, maybe let them know how much sleep that their kid needs a night. I know for me, when I had kids, that it was hard to really get a routine down and decide what was best for them, but they need about 10 to 12 hours each night. A routine, set a regular bedtime and wake up time, and maybe turn off TVs and phones and tablets like an hour before they go to bed to kind of wind them down and help them go to sleep. As far as medications go, we want to make sure that they know that they need to take the medication prescription as ordered, as directed by the provider, and not to share it with other children. We know that it gets tough trying to get your kids to all these appointments all the time when they're sick, and maybe you have some leftover, or your kid wouldn't take it one night or whatever, but we want to make sure that they know that they can't give that to another child. But we want to basically let them know that we're here for them, and that if they need anything, like any support with childcare or finding a dentist or whatever, we can help them in whatever way that we can.